Hi, I'm Peter Norton. Today we're joined by Sydney prosthodontist Dr. Ben Lee, who has kindly agreed to talk us through a case he recently presented to the ADA. Ben, thanks for joining us.
Thanks so much for having me, Peter.
So talk us through the case. It was essentially a lady who wanted to have her anterior crowns replaced. Is that correct?
Yes, the patient's name is Susie. She's a mid-aged female patient who is particularly concerned for aesthetic reasons. Now, Susie have had her anterior two crowns, 1-1 and 2-1, carried out, according to Susie, about 20 years ago, where over the last 7 to 8 years, she has noticed that due to gingival recession, that the discolored tooth structure is now showing. And given her very high smile line and her very bubbly personality, she finds it is really hindering her social life, being who she is. So for cosmetic reasons, she would like to have the crowns changed.
So I understand previously these teeth had endodontic treatment and cast post-cores
Yes.
and PBM crowns.
Yes.
What were the reasons for that treatment at the time?
She did have a knock on these teeth and resulted in their devitalization. So both teeth have had a root canal treatment carried out, as well as cast, post, and cores, apexectomy on both teeth, and subsequently a splintered 2-unit teeth-supported fixed prosthesis.
So they were individual PBM crowns that were joined together?
Splintered, yes.
Okay, great. And did she have any relevant medical history that would impact on the treatment?
Not significantly irrelevant, no.
And what were the treatment options that were presented to Susie in terms of obviously replacing the crowns, but any other peripheral work or treatment that might be needed?
Yes, given it's an anterior case, and everything is on display in her high smile line, in addition to replacing the two crowns, I've also discussed the potential option with Susie to carry out non-vital bleaching, because at some stage in the future, once we replace her crowns, she's going to have gingival recession again. And given her teeth are quite heavily discolored, I thought that may be an option to buy her even more time, to make it even more recession-proof, so to speak. But that would involve removing the cast, post, and cores for both teeth, carry on non-vital bleaching prior to treatment. The other option that was discussed was some sort of gingival surgery to balance out the gingival zenith. But given they all are potentially complex treatment and treatment time is going to be longer as well, Susie really wasn't too keen on all that. She was after something that's a little bit quicker in treatment to give her smile back.
Still a good lift. Understood. So what are the challenges that you would anticipate or prepare yourself and the patient for in a case like this? For example, if you take a crown off and it's all decayed mush underneath,
yes.
What then?
Yes, we never want that to happen, do we? So for Susie's case, what we did is we actually taken an impression, made a model, and then on the model we've actually constructed a retainer, like an orthodontic retainer, before treatment, so that on the day, should something like that ever happen, we can inject some temporary crown and bridge material into the retainer to fabricate a removable provisional for Susie to wear home.
And are there any pre-operative instructions you give your patients to make treatment as smooth as possible?
Absolutely. In a case like this, we wanted to give ourselves a stable gingival platform to work with before we get started. So in Susie's case, I got her to use interdental toothbrushes dipped in chlorhexidine solution 1 to 2 weeks pre-op, in addition to her usual brushing technique, which is pretty good in her case anyway. So that significantly will reduce any form of gingival inflammation before we start treatment. And this makes it gives us an excellent gingival platform to work with, so that we're not going to get any unexpected gingival recession subsequent to treatment.